Thanks for joining this virtual town hall. We do this periodically at Emanate, especially during the COVID times. We've had about 3 of them. I think this is the 4th one. So my name is Gurjeet Kalkar. I'm the Chief Medical Officer at Emanate. We are a 3-hospital system, just about 30 miles east of Los Angeles. We have 3 hospitals. We have 625 beds. Unfortunately, because of what's happening, they're 100% occupied. We have folks waiting in the ED to get admitted. We have about 1,000 physicians, 3,700 employees who are doing their best they can in this crisis. Today's virtual town hall is going to focus on where we are as far as COVID is concerned, the numbers, the statistics in California, locally, as well as in the Emanate vicinity. Then I'll talk a little bit about the Mask Up program. We think masks are very important to curb this pandemic. And then I'll move on to the vaccines. Of course, we have the vaccines coming, but it's the vaccination which is going to save lives, not the vaccines. Okay, we'll start with the grim numbers we have. Sadly, COVID marches on. This slide illustrates where we are in California. Right now, we're having more than 30,000 cases per day. As you notice that we started off well in March when we had the complete lockdown, but as the lockdown was lifted, the cases went up. Then we had some respite for a month or 2, but since then it's picked up again very, very steeply. This slide illustrates the number of total cases in California. When this slide was made about a week ago, we had 1.4 million cases. Today we have more than 1.6 million cases. You can see when the governor eased the limits, how it's taken off. This virus is very, very infectious, very difficult to control. It's like a whack-a-mole. You take the precautions, it gets suppressed, but a couple of weeks later it picks up if people are not taking the adequate precautions. These are numbers in LA County. We have 500,000 cases in LA County so far. Approximately 1/3 of the cases in the whole of California are from LA County. These are the numbers in our vicinity. The biggest city next to us is Pomona, which had 10,000 cases. In Covina and West Covina, we have approximately 6,000 and 3,000 cases respectively. This is an important slide. If you note that most of the cases occur in patients who are between 18 and 55 years of age. If you add them up, they're more than 50% of the cases. So most of the cases are occurring among the young folks. Unfortunately, they are the ones who are transmitting this virus to others. These are the deaths in LA County. In our peak in July and August, we were hitting about 50 to 60 deaths on average. Yesterday, we had 90 deaths, unavoidable, unfortunate deaths yesterday, 90 deaths. And this number is not plateauing, unfortunately. We expect the numbers could be worse in the next week or 2. As people come home for Christmas, we think we're going to have another surge in the 1st and 2nd week of January. We are doing everything we can to be prepared for it, but this is a very, very difficult task. We have all the resources mustered for this. Now, this slide is very important to see that, as you may know, that most of the deaths are in patients over 75. Folks over 80 years of age, they have a 40% mortality rate. 40% deaths are in folks who are over 80 years of age. If you notice on this slide, individuals who are young, the death rate is very, very low. And that's given this false sense of, machismo among the youngsters that, they are invincible. But unfortunately, they are taking it to their homes, to their mothers, fathers, grandparents, and giving it to them. And those are the ones who are suffering from this terrible disease. This slide illustrates the disproportionate effect on our minorities. Hispanics are about 35% of the population, but 45 to 50% of the deaths are among Hispanics. The governor is using a tier system based on our ICU capacity. When we went down below 15% ICU capacity in a certain area, we were giving the purple tier. And right now we have zero capacity in our hospitals. We are down to beds in the EDs. We have patients waiting in our EDs for up to 3 days. Overall capacity in LA County is less than 1% today. We at Emanate meet pretty much every day, where we discuss the numbers, the statistics, our PPE supply issues, our communication with the LA County authorities to see what we can do during this pandemic. Today we have 185 patients in our hospital, 90 at Queen Valley Hospital, and approximately 50 each at other 2 facilities. We have 0 beds in our ICUs. We have 10 to 20 patients boarding in our EDs who have COVID-19. Next, I'm going to focus on masks. We are part of the Mask Up campaign. The reason we bring it up is because masks are cheap, easy to put on, and are probably the most important things we can do to tamper this pandemic. Now, all masks are not made the same. So there's a lot of confusion about masks, and I want to spend a couple of minutes on this because the masks are here to stay with us for the next 10 to 12 months at least. We know masks are important. If individuals wear masks, whether they have the virus or not, the transmission is definitely lowered markedly, especially if somebody who has COVID-19, he or she will not transmit the virus to other individuals. But also it does protect people from getting the virus. That has been shown in the later studies. Roughly we have 3 kinds of masks. We have the N95 respirators, we have the surgical/medical masks, and then we have the cloth masks or gaiters. I want to comment on our cloth masks because that's what most of the people are using. It's important to know what kind of cloth mask one should be using. Of course, it should be fitting nicely. It should have at least 2 layers. 1 layer masks are not enough. If you're able to see through a mask, that is not a good mask. Gaiters are quite popular among youngsters especially, but if they are 1 layered, made of vinyl, they are no good. They should be at least 2 layers. Yes, the mask can be washed in your washing machine without any issues. So it's very important to keep this in mind if you are going to wear cloth masks or gaiters. Otherwise, your protection is subpar. Next, we're going to move on to the vaccines. I mean, this is the crux of the problem here, that this virus, we don't think we can get control of it without vaccination. On the therapeutics front, we have not made a lot of difference in treating this virus because we don't have a good antiviral. When I say that, there's not a very good medicine which kills this virus. We have this medicine called remdesivir, but it doesn't do that well. Similarly, we use steroids. Yes, it decreases the inflammation caused by the virus, but again, we don't have anything which can kill this virus very quickly. And the reason is this virus multiplies and changes quite a bit, and these antivirals are not very effective. For that reason, vaccines are going to take us out from this pandemic. So as you may have been reading that Pfizer and Moderna vaccines are being given to healthcare workers starting this Monday. Just a couple of points about why vaccines. Some folks have said that we should let the virus run its course and have so-called herd immunity, which means people get infected and the whole herd or the whole population gets infected, and that provides immunity. Sweden tried this approach, failed miserably. Yes, young folks got it and survived and got the immunity, but the older folks unnecessarily died. So if we let this approach go on with herd immunity, we will have thousands, if not millions, of deaths before we get herd immunity. And we cannot afford that. For that reason, vaccines are the way to go. So roughly there are four kinds of vaccines. You may have been reading about the mRNA vaccine, which has been approved. We have the mRNA vaccine, we have so-called adenovirus vector vaccines, and we have protein vaccines and inactivated vaccines. So presently I'm going to focus on what has been authorized. We call it emergency use authorization. We don't have the full approval by the FDA as yet. As you know, last week Pfizer, in collaboration with a firm in Germany, BioNTech, got an emergency use authorization for their mRNA vaccine. A few words about mRNA. It's these are proteins outside the nucleus of the cell, and these can be used to basically give messages to produce any kind of chemicals in a cell. They do not reside in the nucleus where the DNA resides, so they will not change your DNA. There's been a lot of things said on social media that this will alter your DNA. That is not true. There's also been an issue about the mRNA vaccines are new, but the work on mRNA has been going on for about 20 years. It is just that because of the COVID crisis, it was expedited, and we have these mRNA vaccines. So in general, I want to say that they are very, very safe. So the first vaccine which was approved was the Pfizer-BioNTech vaccine. They go through 3 trials, so-called phase 1, phase 2, phase 3. In phase 3 trials, each vaccine has to enroll at least 30,000 individuals. And they worked well. We noticed that we've been told that they're 95% efficacious. This is given in an intramuscular fashion. Its first dose is given, and it has to be given again in 3 weeks. The biggest issue with this vaccine is storage. It has to be stored at minus 70 degrees centigrade or minus 94 degrees Fahrenheit. These are these ultra low freezers which institutions have to acquire to store this vaccine. If these are not stored at these temperatures, we have only 5 days to use these vaccines. So thereby the rush among all hospitals to vaccine this week and the coming week, because most of the hospitals do not have these ultra low freezers. The other vaccine which was approved was Moderna, which also uses the same technology, mRNA vaccine. It has a similar efficacy. When I say efficacy for these vaccines is defined as somebody not getting any clinical severe disease. We do not know as yet, data is still coming, that the folks who get the vaccine can get infected but do not go on to develop the disease with symptoms of fever, pneumonia, etc. So 95% efficacious. I want to comment on this efficacy part. Now, just comparing these vaccines to other vaccines available, for example, tetanus is the most efficacious at 100%. Chickenpox, measles, rubella, German measles, they're in the 90% range. So comparing that to the previous vaccines for pneumonia, etc., this vaccine is very, very efficacious. 95% is fantastic. Also, some people have said we have rushed into these vaccines. Yes, it's true that it took us nearly 25, 30 years to develop the shingles vaccine or flu vaccine, but because of the severity of the issues here, everybody worked on it, and we have been able to produce these vaccines rather quickly. We feel comfortable with the scrutiny, the data, the FDA being involved. We feel comfortable that this has been a safe process which has been rolled out very, very efficaciously. Further down about the vaccines. Now, if anybody is interested about all the vaccines in the market which are coming out, I would refer you to Google Corona Vaccine Tracker in New York Times. It'll take you to a site which tracks all the vaccines being developed in the world. Presently, as you know, 2 have been approved. Another 2 will be approved very, very soon. Right now in the US, we will be dealing with Moderna vaccine, Pfizer vaccine, and down the road we are going to have other vaccines like Johnson & Johnson vaccine and AstraZeneca vaccines. The advantage of the Johnson & Johnson and AstraZeneca vaccines are that they can be stored in a regular freezer. Johnson & Johnson vaccine, which comes out in about 3 months, will be a one-shot vaccine. Presently, all the other three are two-shot vaccines. So that'll be a huge thing for rolling it out to the interior communities, not only in the US, but other parts of the world. Now, when somebody gets vaccinated, they start working pretty quickly, but it takes about 4 to 5 weeks before somebody acquires immunity. And that's important, that if somebody's been vaccinated, he or she still has to wear the mask for this reason. There are some other reasons which we will go into. So vaccines, we have the vaccines, they are efficacious, they are here, but it's not vaccines alone, it's the vaccination which is going to save lives. So we have embarked, when I say we, the US has embarked on a very, very ambitious project of vaccinating at least 300 million folks in our country, and that's 70% of our population, because we need about 70%, at least 70% of the population to be vaccinated to attain the so-called herd immunity. When the virus, in that environment, will not have any place to go to, and it literally dies in the community. So we are going to be vaccinating 300 million folks in the next 6 to 8 months. And it's a huge project. So far it's going well. As you may have heard, that in the first phase, we are vaccinating our healthcare workers, and then immediately followed by our elderly in our skilled nursing facilities. This is going to happen in December. In January, we will be giving about 25 million vaccines to our non-healthcare essential workers. That include non-healthcare workers. That includes the police force, teachers, grocery workers, all the folks who really help us lead sort of the normal life we are leading right now. So in February, March, these folks will get it. What about the general public? It appears the way things are going, they're going quite well. We most likely will be able to offer these vaccines to the general public in the second quarter of 2021. So there are many questions about the vaccines. We'll go through the ones which I feel that people are going to ask about. So the first question is, if there are so many different vaccines, what is the best one for me? So right now, we have 3 or 4 being released. They're all very efficacious, close to 95% efficacy. So I would recommend take any which is being offered to you. What about safety? I touched a little bit about it. It appears that we have rushed through it, but not really. The technology, the science behind it has been known for decades. FDA is very, very, very careful. I think we have the most robust process in the world as far as evaluating not only vaccines, but any drugs in the world. So I feel very, very comfortable to take this vaccine. I personally think that it's not only a personal choice, but it should be a personal responsibility that we take this vaccine so that we can stop the spread of this virus in the community. I had mentioned about mRNA technology being new, relatively new, but it's very safe. Again, want to reiterate that the mRNA is outside the nucleus of a cell. It will not alter the DNA. As somebody said, it gives the signal for a cell to produce the immunity, and then just like a Snapchat, it just goes away. It's not going to linger on to make any changes in your body. So we feel very, very comfortable taking the mRNA vaccines. The other vaccines coming out with Oxford, AstraZeneca, or Johnson & Johnson, those use something called adenovirus. Those viruses are are around us all the time. These are cold viruses. And those vaccines have been used for many decades without any long-term side effects. The issue of Guillain-Barré neurological syndrome was seen with older vaccines many, many years ago. You may have read about a couple of allergic reactions in Great Britain with the Pfizer vaccines. And those 2 individuals had history of serious allergies, and that's how they had the anaphylactic reaction or serious reaction. But since then, this has been given for now more than 500,000 folks in various parts of the world with no serious reactions. So the next question is, what are the possible side effects? Here I want to discuss a little bit about side effects versus allergies. Every vaccine has a few side effects, whether it's pain in the arm, where we get it, or a little bit of fever or fatigue or chills. But those side effects are manageable. Those are part of the vaccination process. We do not worry about it. It's the allergic reactions we worry about. And those are folks who have previous allergies with vaccinations or allergies to the contents of a vaccine. Those are the folks who should avoid these vaccines. Fortunately, there are not many who have that severe allergic reaction. So minimal side effects. Some folks will say that take a Tylenol or Advil-like drug when you get the vaccine so that you don't get the fever, chills, fatigue, headaches for about 12 to 24 hours. I think that's a good approach that is taken when kids are vaccinated. Everybody gets a Tylenol to prevent these side effects. So if somebody has history of allergies, hay fever, etc., they should not worry about getting any serious reaction or allergic reaction from these vaccines. How long will the vaccine last? We do not know the answer to this question. Related to this, folks who have got COVID-19, initially we were told the immunity lasts only 3 months, but then studies came out 6 months. Then we had another study come out a couple of days ago that this immunity persists. The immunity can be checked with antibodies, but those are not the only things which the body uses to mount an immune response. There are so-called memory cells or T cells, which we think are going to provide longer immunity. It looks like at least a year. So more to come on this. For now, we do not know when the second shot will be, or the third shot will be needed for some of the vaccines. How about these viruses mutating? You may have read about, there was the viruses mutating in Great Britain. Will the vaccine work? The viruses in general keep mutating quite often in the nature, but we know from previous experience that these changes do not affect the efficacy of the vaccine. So not good. It's thank goodness that we don't have to worry about these virus variations going on. Then the biggest question, if I've had COVID-19, do I still need to get vaccinated? So short answer is yes, but no guidance by FDA, CDC when to do it. Initially people said 3 months, now folks are saying 6 months, but it's an individual decision. It's not going to hurt you to take the vaccine if you've had COVID-19. But in general, most of the medical community says for 3 months you are protected. You could take the vaccine after 3 months. A booster shot question is there. As I mentioned, we don't know when we will have to take a booster shot after the initial set of 2 shots for these vaccines. Another question is, my parent got the vaccine. Am I safe to visit her? So a few things to keep in mind if somebody's been vaccinated. It takes about a month to acquire the immunity. During that time, that person is still vulnerable. That's one issue. So for a month or so, do not feel comfortable around that individual. Secondly, is that these vaccines prevent serious infection, but some folks will get very mild infections, and they may be asymptomatic, and they can still transmit this disease to individuals around them. So for that reason, if you do visit them, you should still do the masking as a routine. Another question we get is, once I get the vaccine, do I still need to wear a mask? As I was saying, that yes, because we do not know for sure that once you're vaccinated, whether you were able to get the infection in a mild form, but still able to transmit to other folks. The Moderna data is promising that it is preventing asymptomatic infections, but only time will tell. For the time being, we think as far as masking is concerned, you should mask for the next, I would say, 9 to 12 months until more data is available. There was another question about mRNA vaccine replacing my DNA, and I've answered that, not to worry about that. And fortunately, these vaccines are going to be free. Nobody will be charged anything for these vaccines. So that's all on the vaccines. I will be, I think, ready for any questions here. But as I said, vaccines are the way out of this pandemic, but it's a long ways to go. Until then, we must believe in science and we should not let our guard down. Okay, and that's where we are right now. I am going to be taking questions. Will eminent be vaccinated in the general community? The answer is no. Actually, so this is how it's going to work. You'll be approached by your insurance plans how they are going to vaccinate you. They are using CVS or Walgreens as the sites to do it. Down the road, when we have different vaccines which can be stored very easily, it may be possible to get these vaccines at your healthcare provider's office. But for now, we are focusing mostly on healthcare providers, essential workers, elderly in the next 2 to 3 months. The general public, as I was mentioning, will probably be able to get the vaccine in second quarter of 2021. How long will it take for the 70% of the population to receive the vaccine? The goal is to be that we should be able to vaccinate 70% of the population by middle of next year. So that's why we feel the third or fourth quarter of 2021 will be a different world. We really sincerely hope so. And barring any unforeseen changes in the virus, we expect that you'll have a much better Thanksgiving and Christmas next year. All right, that's the end of the broadcast. We are engaged with our communities. We want to do the best we can under the circumstances to provide the best care for our folks in our vicinities. I will be happy to answer any questions on our website, and I will answer those questions personally. Thank you for joining. Bye-bye. Have a great day.